I want as few a number of people to die as possible, and that's all we're working on.
The United States has passed 100,000 deaths in the coronavirus outbreak in less than 4 months. It has seen more fatalities than any other country, while its 1.6 million confirmed infections account for about 30% of the worldwide total. The first US infection was reported in Washington state on the 21st of January. Globally, there have been over 5.6 million people recorded as infected and more than 350,000 deaths since the virus emerged in the Chinese city of Wuhan late last year. California became the 4th state on Wednesday with more than 100,000 cases. New York, New Jersey and Illinois were the first 3 to reach the milestone.
And hopefully we're going to come in below that 100,000 lives lost, which is a horrible number. Nevertheless, it's a horrible thing. Could have been stopped. It should have been stopped at the source, but it wasn't.
While the nation's top infectious disease expert says a second coronavirus wave could happen, but it is not inevitable, a leading researcher says the data is clear. The path ahead in the COVID-19 pandemic is being shaped by masks.
You want to keep it the way it is. You don't want to see panic, because there's no reason to be panicked about. But when I mentioned the flu, I said, actually, I asked the various doctors, I said, is this just like flu?
The US Centers for Disease Control and Prevention also said in a new guidance posted on its website that antibody tests used to determine if people have been infected in the past with COVID-19 might be wrong up to half the time. Antibody tests, often called serologic tests, look for evidence of an immune response to infection. The CDC says the antibodies in some people can be detected within the first week of the onset of the illness.